things that we've been focused on really from day one, things like nursing homes and assisted living facilities. We've put huge effort into protecting those, and that's something we're going to have to continue to do day in and day out for the foreseeable future. We also are looking forward to ways to get our society back on a stronger footing as we go forward safely. And I know you guys are going to be a big part of that. So thanks for all that you're doing, and I look forward to seeing the recommendations of all the various committees as we look forward to get the best ideas on how we move Florida forward in a safe and effective way. And with that, I will kick it over to the Lieutenant Governor.
Great. Thank you, Governor, again, for your leadership during these most challenging times for Florida. And I'd like to reiterate our expression of gratitude for all of those on this call that have worked so hard for the past several days. We have received countless information from our subgroups and very impressed with the quality and the caliber of the work being done there. I know that there's been feedback and input from more than 100 individuals. And so, again, thank you for all the work that you've been doing leading up to today. So with that, I think we'll kick it off very quickly to Senator Simpson to give us a recap of his subgroup meeting. I know you discussed nursing homes, ALF, insurance, local government, public safety, and other items. So if you could please give us a recap, and then we'll open it up for questions and comments.
Thank you, Governor. We worked very hard this morning, and I, again, took some notes I'm going to try to share and be brief. We did kick it off with Steve Ballmer, with the CEO of Leading Age, talking about our nursing home and long-term care. Some of the guidelines that are being put together from the CDC or through ACA, how we should regulate those nursing homes coming back and opening up. And obviously, when you think about nursing homes, long-term care, ALFs, we're talking about advanced care, right? So we're not talking about getting back to normal there. We're talking about isolating and other things. But some of the ideas that were discussed were temperature checking the staff each day or multiple times a day and residents, restricting visitors, no community dining at this time, conference calls around the state to the different associations to compare notes to see if there are any things that associations or certain parts of the states are doing better than others, or things that they're learning from other organizations. Isolation units, so that if someone tests positive, they will be able to quickly isolate patients and so that they can take care of them. And also then battle the negative effects of the isolation using technology, telehealth, doing the, having folks call in, FaceTiming and things of that nature to make sure that we fight the negative effects of isolationism, using a lot more telehealth, in-home fitness programs so that our seniors can continue to have their fitness taken care of and participating in those types of programs. Long-term providers should have a prioritization for PPE. Equipment has gotten to the facilities, but they want to make sure that they have their supply lines open to make sure that they have the PPE that would be necessary for to take care of these long-term patients. And the part of the thought there is that these are folks that are, having to be helped brush their teeth or go to the restroom and things like that. So you have a very intimate contact with those folks. So making sure that we have the proper PPE is very important. Also having access to rapid testing. The rapid test is obviously just a point in time. Someone could test negative today and within a few days could test positive, right? Because it's a test in time. And so having access to those would be very important for the long-term health of that facility to make sure that we're operating properly. A clear and present and practical protocol for reopening is very important. So very consistent, very clear protocol was one of the things that was really emphasized on that call. Also work with the local hospitals relative to their area to make sure there are transfer protocols, that everyone is collaborating so they'll know how to bring someone to the hospital or receive someone from that hospital. They brought up liability concerns from lawsuits or other liabilities that would come out of the COVID-19 era. And then we discussed the financial impact, and obviously the costs are increasing on these facilities, and they are part of the federal government's CARE Act, but we want to make sure that we're mindful of the fact that their financial burdens are really great on these types of facilities. Moving on to the professional health care services, Cassandra Paisley, the Division Director of Florida Department of Health, give an update. There are many different types of facilities in Florida. We have executive orders for supplies. The governor's team has been helping get a lot of supplies to a lot of our facilities around the state. The renewals of licensure, and the Surgeon General has the ability to reactivate licenses and to make sure that we're getting licenses approved and renewed in a very timely fashion. Telehealth is being used more. Using other practitioners from other states has been authorized, I believe they said, under the executive order. As we reopen these facilities to general use or to visits, we're talking about making sure that each of these facilities have reviewed their policies and procedures for their supplies of PPE, their visitor protocol, their training of their staff, sick leave policies for their staff, because obviously this is going to be something that's going to go on for many months in these type of facilities. Make sure that the staff has full knowledge of the symptoms. Most folks know that, the symptoms, but making sure that your staff is really trained to recognize symptoms is going to be very important. Having a plan for a new outbreak. So if we're going along for several months without an outbreak, and obviously we start seeing numbers rise in any part of the state, there should be a pre-plan put in place to help with that outbreak. Physical distance for the waiting areas. Some folks are saying their waiting rooms should actually be in the car. There will be specific times that someone would come in rather than having a waiting room with people in it. Even with PPE, having folks wait out in their car would be probably a better plan. And then they can call or be called to come into the facility. Reviewing of cleaning procedures, and then continuously monitoring resources. It's very important to have the data available with checklists where you're monitoring for all of those PPE for your employers and for any of your patrons that you supply that material to. Receiving data from government agencies around the state, considering what others are doing, using best management practices, establishing a surge plan within their networks with the providers, of the other providers of care. So if one doctor's office or dentist's office or so on has an outbreak or has an issue where some of their employees or caregivers have a problem, you can shift those to other caregivers in the area, those patients. Then we switch to Dr. Rudy Liddell, the President Board of Trustees of the Florida Dental Association. The Dental Association obviously got ahead of the curve very quickly and shut down on their own. And then they have been very supportive of the governor's actions since the shutdown has occurred. They have been treating dental emergencies and trauma. Obviously, any of these things can lead to serious infections. They're treating those kinds of things. The statistics they gave us, I believe, was 80% of the dentists are seeing emergency patients. 90% of them are seeing less than 10% of their normal volume. They talked about maybe working with the governor to extend the bridge loan program. And then going forward, we talked about screening the patients before procedures. Again, the questionnaires that would be asked: have you traveled? Where have you been? Checking temperatures when patients come to the dentist, if they're allowed to reopen on a limited basis. Screening their employees daily for temperature checks, making sure they have the proper PPE to perform their procedures. Having again the testing, the fast test as we call it, for the COVID-19 virus. And Dennis talked also about perhaps having people wait in their car for their appointments and coming in as other folks exited. And then they also would need to be reclassified as an essential frontline provider because they're not allowed to buy PPE today. And so by reclassifying them as essential providers, they would be allowed also to buy that PPE. They are also hoping to start elective procedures in early May the 4th perhaps, but certainly no later than May the 8th, which is when the governor's current executive orders expires. We heard from Dave Altmeyer with the Florida Insurance. He's the Florida Insurance Commissioner. OIR has taken many actions to help make sure that our insurers in the state are being taken care of. Early in the process, they asked for health insurance companies to reduce the cost sharing and work with policyholders. That led to the, for testing to be fully covered. We waived the cost sharing of the testing. They asked pharmacists and pharmacies to fill prescriptions early and to make sure that there would be less trips going to those providers. They need to insurers need to update their operations planning to make sure they have virtual options for their business transactions. Workers' comp needs to comply with all regulations. They've worked with facilities on telemedicine to broaden access. Healthcare providers have expanded the telemedicine access, including for mental health, which was very important. They've been working with providers for that. As it relates to the business interruption insurance, most of the policies excluded pandemics, and so they're very concerned if we retroactively have to pay those policies, that could obviously have very large consequences on the industry. And so I know that that's going to not only necessarily be litigated, but obviously legislatures will be taking that up around the country and obviously in the state of Florida. Concerned about the litigation, how the outcome of that litigation around the country as it relates to retroactive paying on this type of a policy on a pandemic where it's been excluded, how that will negatively affect our businesses. They're also planning for the 2020 hurricane season. They are looking for insurers to be up to speed on virtual systems for claims, and they have new ways to have virtual access, and obviously these systems are being brought up to speed and reinvented all the time at this point, and they think that's very important, especially in the middle of the C-19, COVID-19 outbreak. Having virtual systems will be very helpful in the future. Some of the concerns are looking for what are going to be the long-term impacts on COVID-19 that we currently aren't thinking about. What are the emerging risks? And obviously in litigation, it was a continued theme about the long-term health of the industry. Alex Sanchez gave us an update on the Florida Bankers. He's the CEO of the Florida Bankers Association. He gave us an update on the banking industry. The banks have adjusted very well in their operations. People have access to their money. They have access to online digital banking, appointment banking. Our banks have done very well in the state of Florida, working with the Small Business Association, the PPP program at the federal level. Florida was third in the nation for approved loans, approximately $18 billion through the PPP program. I believe the president is signing the second tranche of that legislation today, and then our banks and credit unions are ready to move forward currently, and they're up and running for business, and people seem to have a very good handle on being able to have access to their money. This is more, as I pointed out, is more of a health epidemic, and the last Great Recession was more of a liquidity issue, right? And so now we are not with a liquidity issue, we are with a pandemic, health pandemic. Mayor Daley, we heard from him from Tallahassee, and some of the impacts on Tallahassee and other cities. Their number one priority is, of course, the health and safety and welfare of the citizens and their staff. They immediately canceled all large events, as have most communities. They are cleaning their buses, limiting ridership, or an enhanced cleaning, and limiting their ridership. They've enhanced their PPE for their first responders. And obviously that's going to be something going forward that's going to be important until there's a vaccine or really good therapeutic medicines. They've been communicating really well with their citizens. That was one of the things that they thought had really made their situation go a lot better, is the communication of all lines with the citizens and all the stakeholders in the area, businesses, colleges, hospital systems, law enforcement, and so on. And they've been holding the online meetings that the governor authorized, and obviously they think that the governor may need to extend that executive order to where local government can meet virtually for maybe another certain time period in this process. And one thing that they talked that may be positive for the long-term betterment of the system is they have virtual building inspectors, and it's really streamlined their process. And that was one of the things the mayor had mentioned that they may do in the future. That may be something that after the pandemic's over, they still continue to do. So I think they're looking at new ways to do business and be more efficient. The mayor also talked about their utilities. I think it's a city utility there, and they're working with all of their customers who can't afford to pay, and then they're going to work with them to come back online and be able to pay over time the back monies. We shifted from there to Amy Mercer with she's the executive director of the Florida Police Association. The Florida chiefs wanted to make sure that they had very clear direction on what they were supposed to be doing, very specific guidelines as it relates to arrests. They do not want to become the party of 10 police system. They want to make sure that there's clear direction. They do not want this pandemic to become a source of problem with law enforcement with the communities trying to police gatherings and activities. They're very concerned about their frontline safety and the PPE for those frontline officers. Funding is a serious problem with our local cities and communities, and they're obviously concerned to make sure that there's enough funding to continue their law enforcement activities. And then, of course, they're suggesting the state should prepare for a relapse of the COVID-19, that we should be preparing that if there is another surge, how would we handle that, and how are we going to isolate it to specific areas, because there may be pockets. Most of the state may be okay, but you may have pockets. How would we handle that through our law enforcement? And they're very concerned that law enforcement continue to protect all crime victims, and to do so, they need their academies up and running to continue the training to make sure that we are getting our law enforcement officers, the ones coming into the system, continue to come into the system in a timely fashion. So having the academies open would be very important to them. They stressed, again, very clearly that having a very good clarifying direction on law enforcement's role with the pandemic as it relates to crowds and things would be very important. And then their last concern was litigation around the idea that they could be accused of obviously all the things that would come to mind in normal situations in crowd gatherings and things of that nature. So they're very concerned about litigation also around the state. So that's my report, Madam Governor, and I'm prepared for any questions or discussion.
Excellent. Thank you, Senator Simpson. And I know you mentioned a few of our executive committee task force members that have been participating not only in your subgroup but other subgroups as well. And so, again, we appreciate those of you that have been doing double duty. Are there any questions or comments or thoughts around Senator Simpson's presentation?
Governor, this is Jose Oliva. I just want to say that it's extremely encouraging to hear that the work of incoming President Simpson's committee is looking particularly at, not just in the healthcare space, which is enormously important, to prevent what is later going to be a backlog of pre-existing conditions for people, but also in regards to law enforcement's approach of not creating a police state. I think that's extremely encouraging to hear, and I'm glad that we're having that conversation. And, of course, liability, massively important as we go forward, that people feel that if they're following guidelines, that certain protections are going to come with that. And how exactly we address that, I think, is important to discuss. But the fact that those things are being discussed, I think, are extremely helpful, and I appreciate their work there.
Excellent. Agreed. That issue of liability has seemed to be a continuous theme that we've heard throughout various of the subgroups. So, again, we appreciate your work, Senator Simpson. Additional comments?
Senator, this is Eric Szilagyi.
Yes, Eric, go ahead.
Thank you. Senator, first off, thank you very much for your work in this area. Nursing homes and assisted living facilities particularly, just given the very vulnerable nature of those that are there and how critical it is for all of us to do what we can to make sure they're protected. With that in mind, was there any discussion around, as facilities are given these guidelines for, continuing to operate, to also have the issue around backup generation and the generators that are supposed to be at all these facilities inspected and certified? The vast majority of facilities do a great job of protecting their customers and those that put their lives in their hands. But we, unfortunately, in the past have seen a few that have not, with catastrophic results. And as we go into hurricane season, this is just top of mind for me and others in the electric space, particularly, where there's no such thing as a hurricane-proof electric system. There will be some outages, and if there's also a secondary outbreak of COVID, I fear that any extended outage without a backup generator to operate not just air conditioning, but ventilators and other necessary equipment will just be exacerbated by this pandemic, and lives will be lost that wouldn't need to be.
Yes, sir.
Senator,
That's a very good. Okay.
Sorry, Senator, this is Mary Mayhew. I was going to respond, but I'll defer to you.
No, ma'am. I was only going to say to Tarek that we did not specifically talk about generators on the call today. What the overarching theme was as it relates to the long term, and you bring up very good points and very necessary points, was that nursing homes, ALFs, and these long-term care facilities will be much differently looked at over the next perhaps 6 months or a year until there's a real vaccine, because of the necessary protection of this population. And so that population is going to have that extended period of isolation. But the generator systems you're bringing up, I'll defer if the Secretary has some information on that. We'd like to hear it.
Governor, would you like me to respond?
Absolutely, Secretary. Thank you.
Thank you both, Senator and Governor. This is Mary Mayhew, Secretary for the Agency for Healthcare Administration. That is a critical point, and as we approach hurricane season, we have been working for many months with all the facilities around compliance with the emergency energy requirements, backup generators. Every facility is required to either have their permanent generator fully installed or their temporary generator on site. 99% of all the assisted living facilities are in compliance with a permanent generator on site and installed. And then, of course, we are also, our regulators are on site verifying that these facilities are regularly testing to make sure that those generators are functioning as we would expect. Nursing homes, most have their generators. Unfortunately, there are still nursing homes that had challenges given the size and scope of their facilities and the magnitude of the generators that they needed to have on site. They've experienced some delays. They must have a temporary generator on site and operational, and we will be verifying that. The public health emergency has just contributed to some of their delay with their permanent generators. But the expectation is that they have a temporary generator that fulfills the requirements and on site, and we will continue to push for the permanent generator to be installed.
Governor Pat Sunderland from Lockheed, we appreciate the Senator's report, but my question is around the rapid testing. I wonder if the committee could give some more color around how we had accomplished that testing, as rapid as possible.
Thank you for that question. I know the governor in multiple of his press conferences has talked about the desire to ensure that Florida acquire as much rapid testing as possible. We've talked about different products on the market. I know that we are diligently working to acquire as much rapid testing as possible in order to be able to deal with specifically in this scenario, the nursing home situation. But obviously, as we expand into a reopened economy with concerns around workforce, obviously that's something that would be a tremendous benefit. So I don't have the exact numbers of what we're looking to acquire, but I know that that is an important part of our strategy in terms of reopening and making sure that Florida is ready to be able to deal with the employment issues, the employer issues. Nursing home in particular is an area where I think the governor contemplates really utilizing and deploying these rapid testing. But I know that I said there's various different products on the market, and so we're working with all of the different companies to be able to acquire as much and as often as possible. But that perhaps DEM could give us an update. I don't know if there's anyone on the call, but we are certain to be able to get back to you on specifics around that.
Okay, thank you.
Governor, this is Jimmy Petronis.
Go ahead, CFO.
Senate President, I just wanted to thank you for all your leadership today on the call. After I wrapped up the call with y'all, I had a call with the sheriffs, and this was just probably just a little bit more of just stress on the situation that we're in. But we all love our law enforcement and what they're going above and beyond anything they ever thought the scope of their job was going to be. But I guess they're getting also pulled in multiple directions in addition to the challenges of dealing with a COVID-19 potential arrest, to what they're getting with PPE, to turnaround quick testing of first responders. They're also getting their buttons pushed by local government. They've got county commissioners and chair county commissions that are trying to do the right thing, to work within the sunshine laws in order to have an established timeline. And they're getting worn out from several different directions on how to turn this huge economy back on. Their specific concerns are trying to get, as much of a prepared timeline, expectations, so they can get the proper, employees in place to deal with that timeline because of the time constraints, because it's not going to just turn off. But I felt for them, and I think as we feel for everybody that's dealing with the challenges that are going on right now. But they really, as this will culminate, I think the big question has been is what type of timeline are we going to see? I know the chief of staff touched on a little bit of it yesterday, but our sheriffs are really kind of getting poked from multiple directions, and I empathize with them. But hopefully, maybe by the end of this call, we can have some type of expectation for all those that are listening on the Florida channel of where they can start to anticipate getting direction finally on where we're going with this. Thank you, sir.
Thank you. Additional questions or comments for Senator Simpson?
Madam Governor, I just wanted to.
Oh.
Madam Governor, I just had two more last things. I would say to anyone out there listening, if you are a nursing home or a group that is supposed to have backup generators, obviously we passed a state law, I believe, that included that in it a few years ago. We've heard a lot about litigation concerns to these groups because they're treating our most vulnerable patients. I would suspect that the state would have no mercy on folks who are not doing what they are supposed to be doing or should be doing. And if you are in one of these facilities of critical care, you need to get your generators in place. Hurricane season starts June the 1st. Number two, just to point out one last position, over the weekend, this industry group is going to continue to work. And one of the things I had mentioned to the subcommittee earlier is if you have any comments or suggestions or new information that you would like to share with the governor, submit those to the Governor's Office of Policy and Budget at Reopen FL Task Force at laspbs.state.fl.us by Sunday, the 26th, because we're going to continue to compile this information. So folks with good information or good suggestions, we still would like to have that information come in so the task force can continue to review over the weekend and early into next week. Thank you.
Excellent. Thank you, Senator Simpson. And yes, we will we'll discuss that at the end of the call and reiterate your call for suggestions. We understand that we have a very tight time frame, but that clearly there are going to be multiple suggestions coming in over the weekend. So we'll talk about that at the end of the call, but thank you for reminding those that are listening. We will transition now to our Education Commissioner to give a recap of his meeting. Commissioner Corcoran.
Yeah, thank you, Governor. We had another good meeting, very productive. On the call with us was Director Moskowitz. He gave us an update, talked about how this is the largest emergency management operation of Florida's history. Some of the highlights that you guys have heard before about distributing 12.5 million masks, 6 million gloves, all the PPE equipment. But the point of his call being on there was to say, even while they're doing this and they're confronting this record pandemic, he is full-blown getting ready for hurricane season. And he started talking about how he's been reaching out with the supply chains, the Walmarts and the Publix, to make sure that the supply is there. He's reaching out to businesses to make sure businesses have a steady stockpile of PPE and stuff they might need, as well as making sure that the families out there can get a 7-day emergency set of supplies, including cleaning and sanitation. He's engaged with the utility companies. They had a robust conversation helping us and Director Moskowitz with some considerations because of COVID. Obviously, how we put people into sheltering is going to be drastically changed. So the capacity is going to have to be that much greater, and how we have some looking at spacing, whether it's this much or this much, where our red spots are. He's looking at hotels and other venues for doing sheltering. The industry gave him some good feedback on that. And then we had more, as it was just said earlier, as many rapid tests as we possibly can. And then the transportation needs, do we use Uber, buses, and how many buses if we're transporting people because of the space requirements. Regardless, he said that DMS and DM, both of them are full-blown ready. They're working on it, and they have not taken, 1 day off from their usual hurricane preparedness. After that, Governor, we got into conversations about where do we move from here as we start, as Senate President Designate said, this weekend as we move together, what do we start doing? And we got into the specifics because we did education, we did utilities, manufacturing, IT, and so we were looking at all those specifics that the speaker has said on previous calls too. Okay, now what are the specific requirements for screening and what do those look like? What are the specific requirements for social distancing and what do they look like? All of the clear signage, what are the capacity limits in certain buildings, what's the mass gatherings, and getting into those, putting pen to paper into those specifics. And then same with school, how do we, all the conversations that we've had over the achievement gap, what do we do coming out of the spring, going into the summer, and going into the next school year? What are all of the measured approach that we're going to take from pre-K all the way through our colleges and getting the achievement gap and attacking it and closing it? In addition to that, getting our colleges and tech colleges completely ready for the onslaught because of the economy and mass producing those short-term certificates in vital areas that could really help us in this not only this pandemic but also in first responders and with the hurricane. And so we decided to do is we would start putting pen to paper. As the Senate President said, I gave him my email and said if they have any thoughts between now and Sunday to get those over to us, and we'll quickly share them with everybody. We've had some great sharing already from some of our members on our committee in different related areas. We've had some stuff starting to come in from our sheriffs, our IT guys, and so I think we're going to be we've had great dialogue, great conversation, great updates. The needs have been clearly defined, and now giving that clear direction, specific, clear, and necessary direction to maintain that safety that we've all talked about. And that was the update, Madam Chair.
Excellent. Thank you, Commissioner. Appreciate your report. Are there any questions for Commissioner Corcoran? Any comments? Okay. Hearing none, we will transition to our third and final subgroup. Is the President and CEO, Dana Young, could please give us an update on her subcommittee?
Thank you, Governor, and hello, Executive Committee members. Our working group call this afternoon focused on issues related to regulatory challenges for small businesses like barbershops, bars and restaurants, etc. We also discussed challenges faced by rural and minority communities, and then we turned to the challenges of reconvening large events like meetings and conventions. The first person we heard from was Greg Picknick. Greg owns a 9-chair barbershop in Tallahassee. And like so many small business owners, it was clear to me that Greg has spent this time while his shop is closed thinking about ways that he can operate his business safely upon reopening. He has some great common sense ideas to keep his customers and staff safe, and these are worthy of sharing. Things like moving into a one-in, one-out appointment-only system, regulating the length of time in between clients, purchasing 2 sets of barber equipment to increase sanitation time. He indicated that if it was possible for the state to provide any resources for small businesses to secure the proper PPE, that would be very helpful. As a small business which has not been open during the last month, he noted that it's going to be difficult for him to secure PPE and appropriate sanitation supplies that are in short supply right now. He believes that there may be a need for re-education of all best practices post-COVID-19 for all barbershop licensees, and he would like to see guidelines posted on DDPR's website as well as emailed to licensees. Next, we heard from Secretary Halsey Beshears from DDPR. His overview focused on 3 subsections: cosmetology and barbers, bars and restaurants, and hotels. As anyone who's ever worked with Halsey knows, and I have, he is committing to clearing the hurdles and finding a path to reopen our businesses while keeping the public safe. He noted that more than 2,400 bars and restaurants have closed their doors indefinitely, and unfortunately, many will not be coming back. The Secretary has been working with stakeholders in the professions that his department regulates to create the best common sense approaches for reopening. The Secretary provided a summary of very specific guidances that they are developing to ensure the areas that I just mentioned operate safely and effectively upon reopening. Some of the common themes that have already been mentioned many times to this group include sanitation, social distancing, and ensuring enough cleaning supplies and PPE items are available in the supply chain. According to Halsey, approaches for reopening might vary depending on the number of cases of COVID-19 that a county or an area of a state or a community is experiencing. He mentioned that many restaurants and hotels may need a ramp-up time of 2 to 4 weeks before becoming fully functional. And there are several reasons for this, such as securing financing and the purchasing of supplies. Next, we moved on to the challenges being faced by Florida's rural communities. We heard from Commissioner Terry Burrows, chairman of the Okeechobee County Board of County Commissioners. And according to the commissioner, businesses in rural Florida are very anxious to reopen, but they want to do that in a safe way with the guidelines that we provide. He also stated that to date, none of the businesses in his county were able to secure federal assistance, which is alarming. Commissioner Burrows then talks about the importance of agriculture and the impact COVID-19 has had on the agriculture sector. It is Mr. Burrows' view that small businesses in his community could not endure much past May 1st, particularly in Okeechobee County, because the winter and spring are the busiest time for their communities. Then we heard from Glenn Gilzine, President and CEO of the Central Florida Urban League. He provided an overview of the impact being felt by minority-owned small businesses. His mission is to connect the African-American community with what he termed the 3 E's: education, employment, and entrepreneurship. Mr. Gilzine highlighted the revenue disparity between white and African-American-owned businesses and believes the path forward for his community is through entrepreneurship. He would like this task force to be cognizant that an event like COVID-19 could lead to compounded gaps in generational wealth. He noted the need for anchor institutions in urban communities to be brought back to life and the need for financial capital, human capital, and emotional support in our urban areas. During the call, we were able to connect Mr. Gilzine and Commissioner Burrows with Enterprise Florida's microfinancing program which serves small businesses with 25 or less employees. And by the end of the call, Commissioner Burrows had already disseminated that information to businesses in his community. So very efficient communication there. Our last topic was to discuss the unique issues surrounding the reconvening of large gatherings, events, and conventions. We heard from Santiago Carrata, President and CEO of Visit Tampa Bay. Tampa serves as a good microcosm for these issues facing meetings and conventions. There are only 4 or 5 large convention centers in the state, and Tampa is one of them. So far, because of COVID-19, Tampa has had to cancel 15 large-scale convention center events, including WrestleMania and some other large sporting events. Those cancellations at the convention center themselves represent a conservatively estimated loss of $122 million. Even as cancellations are occurring, Visit Tampa Bay is looking forward and working tirelessly to try and retain pieces of business that remain on the books for June, July, August, and afterwards. Mr. Carrata believes a phased reopening is necessary. He indicated that convention centers share some characteristics of theme parks and sporting events, and therefore thinks that any guidelines and best practices developed for these mass gatherings could be instructional to reconvening large events at Florida's convention centers. And lastly, obviously, another huge consideration for the Tampa Bay community is the Super Bowl that they are scheduled to host next year. It is a priority that they ensure a successful event like Miami enjoyed last season. One more important note on our call, we were joined by Dr. Lillian Rivera from the Florida Department of Health, and Dr. Rivera urged everyone to continue to follow CDC guidance, as they have listed many items on their website reminding us that additional information is coming out daily as we learn more and more about the virus and how it lives on different surfaces. She also urged Florida businesses to consider consulting with the Department of Health to assist with infographics that can be circulated and posted at businesses. And Governor, after we had those presentations, I passed along the email address for all of our task force members to submit their individual recommendations and ideas to the Office of Policy and Budget, and they will be doing that by Sunday deadline. That is my report. Thank you so much.
Thank you very much. Are there any questions or comments? Any questions or comments?
Lieutenant Governor, this is Jimmy again.
Yes, go ahead.
At the earlier meeting, there was an email address that was sent out regarding for document submission. I've had several businesses and associations reach out to me, so they were both retail in nature and also restaurant hospitality. I have submitted those to that email address, and just to make it easy, so somebody would have to write down a bunch of notes. But if y'all wouldn't mind, just before the end of the call, giving that email address out again, just so the rest of the task force members can have it.
I will do that before we conclude the call.
Okay, thank you, ma'am.
Of course. Are there any questions of this last presentation?
Question, Jamal Sauer, Enterprise Florida.
Yes, go ahead.
Doing a great job, amazing job, because obviously with hotels, restaurant, tourism, and convention, that's all really intertwined with our economy in the state. So with what you said, it'll take about 2 to 4 weeks for restaurants to ramp up. With that timeline, would that be something that they could do once given a potential opening in the future, or would they need 2 to 4 weeks in addition to the time that the state could potentially give for them to open?
Would you like me to answer that, Governor?
Yes, go ahead.
My indication from the presentation by Secretary Beshears was that once these restaurants know that they will be able to open and are given a time certain for being able to open, then they would start ramping up, and they would start, rehiring employees, ordering supplies, making sure that they had proper PPE, and just generally getting ready. But certainly they would not be able to do that until there is a specific date and they have clear indication on what the rules will be.
Thank you. Any additional questions? Okay, well, that concludes the presentations from our industry working groups. And again, my sincere appreciation to those that led the discussions as well as all that participated. I really appreciate all the hard work that went into that. I know you've been able to compile a whole host of recommendations, and I think that that will be very helpful suggestions as we start to compile this information. What we're obviously looking to do is, given all the robust discussions that we've had take place here, both through the working group and within the executive committee, ourselves, we want to make sure that individuals have the opportunity to provide their questions, their input. So again, that email address that you heard Senate President Designate Simpson issue earlier is reopen FL Task Force, reopen FL Task Force at laspps.state.fl.us. But if you are don't have a pen and are not taking notes, feel free, don't worry, they will contact you. OPB will make sure you get that email. But we would really like for you to submit those suggestions, whatever suggestions have come about through your working groups, to the Office of Policy and Budget by Sunday, April 26th. So as you can imagine, our staff will be working over the weekend and into early next week. They'll compile a work product of the industry working groups as well as the executive committee discussions into a report on the progress of this task force in order to reopen Florida. I know that what I indicated is that they'll be working over the weekend, so we expect that we'll be contacted over the weekend. I apologize for any inconvenience this might yield for you all that are, I know, busy working day in and day out. But if you could please work with our staff, make sure you provide whatever commentary, that would be very helpful. As I mentioned, this has been a tremendous endeavor on our part. We want to thank the governor for his leadership. We have obviously tried to compile into a very short time period a very robust discussion on a number of topics, a number of industry sectors in our economy, and we understand that we have been challenged through this pandemic, the likes of which we have never known. But under Governor DeSantis' leadership, we have been steady, we have been focused, we've been data-driven, balanced, and measured. And I suspect as we go into the next phase, those themes will continue to lead the day. And what we really want to see from this group, and we appreciate, again, all your time and effort, is in reality the most prudent and appropriate way in which we can open Florida's economy back up. We know there are many individuals that are eager to open up their businesses, get their employees back to work, and we're going to continue to focus on doing that in a safe and efficient manner. So unless there's any final commentary from any of the committee members, I'll open it up one last time.
Lieutenant Governor, this is Jimmy again. I just got an email from my office. We just received a few minutes ago another $1.7 billion of the CARES Act.
Oh, excellent. Well, thank you for that news. All right. Hearing no final commentary, again, we appreciate all your work over the past several days. I appreciate everything you all have done. Hope you have an excellent weekend, and stay tuned. You'll be hearing from our folks over the weekend. With that, we will adjourn today's call.
You are watching the Florida Channel, connecting Florida.
steroids. Exactly. Sleep in, walk the dog. I used to. You know, the kids are pushing hard. We may lose. Somebody may lose this. Well, I told my daughter, I said, when I retire, you retire? No, should be in college all the time. Based on the market, I'm never.